Yes.
So, if you want to do, so they ask about exposure.
Exposure, what does it mean?
Open. So how can I want to do surgery on the carotid
Carotid.
artery.
Oh.
How can I get to where it is? Will
How
I
to
cut
find?
here? Will I cut here? Will I cut here?
Yeah.
So, and then first thing you need to know is that how many triangles do you remember in the neck?
The neck.
Yeah. So actually, we have the anterior triangle of the neck, we have the posterior triangle of the neck, we have the inferior triangle of the neck. So see, if and then you'll be able to identify this one is the sternocleidomastoid muscle. The sternocleidomastoid, you can check it by yourself. It will come from here, from below of the sternum, because from the name steno. It means steno means from the sternum, right?
Sternum, yeah.
From the sternum, and clado, mastoid from mastoid. You understand?
Yeah.
So clano that they talk about is the clavicle.
Clavicle.
So it attached to the three bones, the sternum,
Yeah.
the mastoid
Mastoid.
process, and then clavicle. That is why this name sternocleidomastoid
Sternocleido.
muscle. So now, if you are able to trace this, you can see it is coming from the mastoid. It is coming down, then comes to this to junction between the sternum and the clavicle. It attaches to this region, and then now, if you want to trace it slightly behind at the back of it, it is where we have the bifurcation of the carotid artery. You understand what I'm saying? Slightly behind it.
Behind.
Yeah, slightly behind it. So that's behind it is what forms the anterior triangle of the neck. So it's just slightly behind it. You're going to see the bifurcation of the sternocleidomastoid muscle.
Yeah.
And then now, if in that place, but now I have answered the question. I just want to write it. They ask, where are you going to make the cuts? You understand?
Yeah.
Because first you have to remember this. They ask about how you expose. First, you cut the skin. You understand? Please
Yeah.
don't forget. First, then the next after the skin, because it is the neck, you have fish. You have subcutaneous fatty tissue. Then you have the fascia of the neck. Then you cut. You're not going to see it in the neck triangle of the neck. You understand? But after this fascia, you will see the triangle. So it is in this triangle that we are going to see the carotid. They call it. Then you see they call it carotid triangle.
Carotid triangle.
Please don't forget. This is the answer. So when you see carotid triangle, then you will see the carotid bifurcation. Carotid bifurcation. Bifurcation means this one carotid divided into two. You understand? This is what they call bifurcation. Bifurcate to become two.
They became two.
To divide to two. So you see inside this triangle, inside here, triangle here, you're going to see the carotid. You understand?
Carotid bifurcation.
This is the answer.
Most of the triangle is made, for example, by mastoid, clavicular, and sternum. Yeah.
Yeah, but you can see, no. That is, will you talk about attachment of sternocleidomastoid muscle, not triangle? If you say that, because it is just sternocleidomastoid muscle come from the mastoid process, then attached to the sternum and the clavicle. That is one thing.
Yeah.
But the triangle is different. Triangle is formed, and if you want to talk about triangle, you talk about anterior, you talk about posterior, and you talk about base.
Yeah.
So then you can talk about the base of this triangle being formed by the clavicle.
Clavicle. Yeah.
Then the anterior part of it being formed by the inferior part of the sternocleidomastoid muscle. You understand? And the posterior part of it being formed by the trapezius muscle. Trapezoid
muscle. Yeah.
This is the triangle.
Yeah.
So then you're going to see carotid revocation. So now you've been able to expose it, but don't forget these steps.
Yeah.
Okay. 41. Operation intervention on the pancreas. Cyst, fistula, pancreonecrosis, and blunt trauma. So, actually, they've talked mainly about known tumorous diseases of the pancreas,
Non-tumorous.
but also they did not talk about pancreas. These are the diseases that you can come across in pancreas. But now they still did not talk about some other ones, because in pancreas you can still come across. No, don't worry, because it's operative surgery, only operative surgery. So it is okay like this one. You understand what I'm saying?
Yeah.
It's operative surgery. If it is for operative surgery, we talk about some other things, but it's operative surgery. So what you are going to talk about here,
What's wrong? You don't go new page to be more comfortable later.
okay,
Okay,
it is true. It will be more comfortable. But because I don't want to talk